Thank you for the invitation. The last presentation deals with the elbow. The topic is midterm results after latitude elbow arthroplasty by using an evaluation set. As we know from the literature, total joint replacement leads to reasonable results in rheumatoid arthritis patients, as also in post-traumatic patients. At least in our opinion, there's a lack of data clarifying how the underlying disease influences the final result. And that's why was the aim of our study to compare specific deficits in function or quality of life after replacement of the elbow using the latitude arthroplasty, comparing rheumatoid arthritis patients and post-traumatic patients. This is latitude elbow arthroplasty. This replacement is on the available on the European market since 25. This arthroplasty is characterized by a very high modularity. You have the usual different stem sizes for the humeral and ulnar stem, but you also have different lengths for the ulnar stem, a short one and a standard one. You can use it as a linked or as an unlinked replacement, and you can do the mechanism for linkage at any time you want. You can also use it together with a radial head replacement. It functions like the well-known bipolar radial head replacement. And you even can use this replacement as a hemiarthroplasty if you want. Here you can see an X-ray example from a patient with rheumatoid arthritis before and after the replacement of the elbow joint. We used for our evaluation a comprehensive evaluation set consisting of different questionnaires. We used general health questionnaires like the SF-36 and elbow and region-specific questionnaires like the DASH, the ACSE, the PREE, and the PRVE. And for clinical evaluation, we used the clinical part of the ACS and did also radiological assessment. We did a retrospective cross-sectional follow-up examination of all the patients we operated between 25 and 29, and were 55 replacements. Unfortunately, 4 patients already died, and 4 other patients couldn't be traced, so we could only follow up 47 prostheses in 46 patients. The mean age of these patients was 62 years, and the follow-up time was 3.5 years. To the results, here you will see the values from the SF-36. As you can see, the brown columns are the normative values which are available for the SF-36 and for the DASH. You can correct these values for sex, age, and comorbidities. The yellow columns are the functional results. Functional deficits are remaining. Better are the mental and the psychosocial results, which you can see with the red columns. The best result, and these results are as good as normative values are for the mental component summary score. Functional deficits remain, how you can see very nicely on this slide. Our patients only reached 50%, nearly 50% of the normative values. Here are the values for the other questionnaires, patient-oriented questionnaires, and the clinical examination. Unfortunately, there no exist normative values for comparison, so you can only see that we reached 60 to 70 points up to 100. Range of motion for these patients show that in average the patient has a bit more than 120 degrees flexion and an extension leg of about 27 degrees. If you compare both main groups, or both diagnostic main groups, the rheumatoid patients and the post-traumatic conditions, you can see these both groups are comparable according to age, to sex, and to the comorbidity status. but patients with rheumatoid arthritis had a better flexion and a greater range of motion, and also the extension leg was smaller. The clinical results expressed by the ACS were comparable, but the grip strength was better for the post-traumatic conditions. These differences were statistically significant. Here, the same values for both groups distinguished. How you can see these graphs are very similar. Both groups have functional deficits, and how you can see on the blue and the yellow columns, only the mental and the psychosocial values are better and nearly comparable with the norm values. For conclusion, also joint replacement of the elbow results in high psychosocial outcome. Functional deficits in the quality of life remain. Our results with Latitude arthroplasty are as good as with other arthroplasties like the Kunrad-Murray or the GSB3. We recommend the use of the Latitude arthroplasty because it has a very high modularity. It helps you to solve problems also intraoperatively. You have an implant which you can use for nearly every indication, and we use it for revision operation as well. Thank you for paying attention to me.